everyone, in this video I want to practice the video for the practice Medical Qigong to do for the people who have problem with the arthritis, arthrosis, or have the back pain, joint pain. Let's go.
Osteoarthritis is among the most common joint disorders and is characterized by joint pain due to wear and tear of the joint. This animation demonstrates the progression of hip joint arthritis. The hip joint is formed by the head of the femur and the acetabulum of the pelvis bone. The articular cartilage found at the femoral head is a highly specialized spongy surface that surrounds the region of bone where it comes into contact with the socket or acetabulum. This is to provide almost frictionless movement of the joint when abducting or pushing outward, adducting or moving inward, flexing forward, and extending backwards. When this cartilage becomes damaged from gradual wear and tear or via trauma, this is called osteoarthritis. This results in narrowing of the joint space and friction-induced inflammation. Over time, this can progress to the development of bony growths, also called osteophytes or bone spurs, which can limit movement and be painful.
Welcome back everybody inside the Anatomy Lab. In this video series, we're diving into the intricacies of the hip joint. First, we'll explore its structure, then we'll cover its possible movements. Afterwards, we'll focus on flexion and examine the muscles involved. Finally, we'll discuss some factors that can influence flexion. Whether you're a beginner or an advanced anatomy student, I'm sure there's something here for you, so let's dive right into it. The hip joint is a ball and socket joint, where the rounded head of your femur fits into the cup-shaped socket of your pelvis. This socket is named acetabulum. This design allows for a wide range of motions in all directions. And let's take a look at the pure forms of these motions to understand specific movement patterns and their function more clearly. The first movement is flexion, which involves lifting the thigh towards the torso, as if you were bringing your knee towards your chest. Its opposite is extension, where the thigh moves back away from the torso, as if you were straightening your legs from a bent position. Abduction occurs when you move the thigh away from the body's midline, just like when you're spreading your legs apart. Conversely, adduction means bringing the thigh back towards the body's midline, like bringing your legs back together. Internal rotation rotates the thigh inwards towards the body's midline, meaning that you turn your toes towards each other. External rotation, on the other hand, involves rotating the thigh outward away from the body's midline, as if you were turning your toes away from each other. Finally, circumduction. It combines all these movements into one fluid, circular motion of the thigh, as if you were drawing a circle with your knee. As mentioned earlier, today we'll focus on hip flexion and the muscles involved. Pure flexion involves lifting the thigh towards the torso, mainly using the iliacus and psoas major and minor muscles, because of their attachment and biomechanical advantage. These muscles start from the lower back and pelvis and attach to the thigh bone, allowing them to efficiently generate force. But of course, they don't work alone. Various other muscles assist in lifting, stabilizing, and can enable more complex movements by adding adduction, abduction, and rotations. To understand these configurations better, let's group the helper muscles into two groups. The first group consists of the anterior fibers of the gluteus medius and minimus, the tensor fasciae latae, and the sartorius. In short, they all help in flexion and also contribute to internal rotation, abduction, and stabilization. The second group consists of the rectoris femoris, the pectineus, the abductor longus, and the gracilis. They primarily aid in flexion, assist in external rotation and adduction. Let's explore what happens when the first group adds internal rotation and adduction to flexion. You probably know this movement from sports like soccer, dancing, or even daily activities. Just keep in mind it can be performed in many different ways, with varying amounts of rotation and abduction. This is just one possible scenario, and understanding this principle of mixing different motions allow us to quickly break down complex movement patterns and grasp how everything works together. Now let's apply this knowledge to group B and see what happens when external rotation and adduction comes into play. I'm sure you recognize this movement because we use it in variations ourselves every day. However, it's not just about different muscles adding to the movement. We also need to understand that muscles aren't binary systems. Sometimes only certain fibers of a muscle contribute to a movement. Also, other individual factors such as bone length, joint form, strength, and so forth play a role in how we move as individuals. But let's move on and talk about factors that influence the range of hip flexion. When you flex your hip with a straight knee, you cannot flex as much as when your knee is bent. Bending the knee simply reduces muscle tension and allows for a greater range of motion. However, passive flexion is greater than active flexion. So, if you use your hands to assist yourself, you can flex even more. Still, your knee position matters because a straight leg can't flex as much as a bent one. I hope this was enough food for your minds for today, and I'm looking forward to see you in our next episode when we talk about hip extension. Have a good one.